Hello everyone, welcome to today's video on sleep and mental health. So in this session, we will explore how sleep affects our mental well-being and how mental illness in turn impacts sleep. Let's dive into this important topic that touches every aspect of our lives. Sleep is not just a time of rest, it's a biological need. Our brain and body go through essential process during sleep that helps regulate our mood, memory and energy. So interestingly, sleep and mental health share a two-way relationship. Lack of sleep can worsen anxiety or depression, and having these disorders can make it harder to sleep. We'll see about importance of sleep. Why is sleep so important? So during sleep, our brain consolidates memories, recharges energy, and helps regulate emotional responses. It boosts our immune system and helps us better handle stress. When we sleep well, we wake up more alert, focused, and emotionally balanced. We'll see about sleep stages. Sleep occurs in cycles, and each cycle includes different stages. Stage 1 is light sleep. In stage 2, our heart rate slows down. Stage 3, it is deep restorative sleep where healing and recovery occur. Finally, REM sleep is when we dream, and this stage helps with learning and emotional processing. So, missing any of these stages regularly, it can affect mental health significantly. So, we'll see about mental health disorders linked to sleep issues. So, many mental health conditions are directly connected to sleep disturbance. So, depression often causes insomnia or oversleeping. Anxiety leads to racing thoughts at night. Bipolar disorder, schizophrenia, and post traumatic stress disorder, that's PTSD, each of these conditions can disturb sleep patterns. So, in fact, sleep problems can often be one of the first signs of a developing mental health conditions. And we'll see about effect of poor sleep on mental health. So, not getting enough sleep regularly can deeply affect our mental health. So you may notice more irritability, emotional instability, and difficulty focusing sometimes. So chronic sleep deprivation can lead to worsen depression and anxiety, and even small tasks start to feel overwhelming when your body and brain are so tired. So sleep disorders common in mental illness. So, some specific sleep disorders are commonly seen in those with mental health issues. So, insomnia is the most common. It's when you have trouble falling or staying asleep. Hypersomnia means sleeping too much, and sleep apnea can cause disturbed breathing, especially in anxious individuals. And nightmares, especially in PTSD, can keep people afraid of going to sleep. How depression affects sleep? So in depression, sleep patterns often changes dramatically. Some people wake up very early and can't go back to sleep. So while others sleep excessively but still feel tired, sleep quality is usually poor only. And sadly, disturbed sleep in depression is closely linked with increased suicidal thoughts and also making treatment even more urgent. So how anxiety affects sleep? So, anxiety often keeps the mind active at night, actually, and racing thoughts, physical restlessness, and even panic attacks can make it hard to sleep. People with anxiety often worry about not sleeping, so which leads to even more sleepless nights. So, it becomes a vicious cycle that worsens both anxiety and fatigue. Then we'll see about promoting better sleep. There is sleep hygiene tips. So the good news is that good sleep hygiene can make a big difference. So try going to bed and waking up at the same time every day. So we need to avoid caffeine, heavy meals, and screens at least an hour before bed. So create a quiet, dark, cool environment for sleeping. And techniques like deep breathing or meditation before bed can help calm the mind. These are the common tips. And role of mental health professionals. So mental health professionals plays an important role in addressing sleep issues. So they screen for sleep problems during assessments and teach patients about mentally no, healthy sleep habits. Therapies like cognitive behavioral therapy for insomnia are highly effective. Sometimes medication may be prescribed. Mental health nurses, psychologists, and psychiatrists work as a team to support better sleep and emotional well being. So, in conclusion, sleep is not a luxury, it's a necessity. So, without proper sleep, both our mind and body suffer. Understanding the link between sleep and mental health can help us to take preventive steps and support uh, those who are suffering and struggling. Let's prioritize rest, practice healthy sleep habits, and support mental wellness for ourselves and others. Thank you.